Sedation Dentistry, Sleep Dentistry. Hi, I'm Dr. Daniel, and I'm here to explain to you what these terms mean and how they can affect you. First, let me give you a little bit of history about myself. I grew up in a small family business working with my father. When I was at the age around 6 or 7, I started working with my dad. We worked with the general public, and we worked in a small community, which I enjoyed thoroughly. At the same time, growing up in a small community, I made a lot of relationships with the people around me. As I worked with them and grew up in that community, I developed relationships over a long period of time, which helped shape some of my decisions about going into the dental field. Alongside of that, when I went through school, I actually did quite well academically. I was one of those children that was very academically gifted. I could do well at almost any subject. I did so well in school, in fact, from a young age. When I was finished all my schoolwork, probably sometime in January or February, I'd spend the rest of the year helping other children in the class and helping some of the more academically challenged children in the school by tutoring and working with them. This carried on with me later on in life. As I finished university and decided what to do with my life, one of the biggest driving forces that got me into dental school was I wanted a profession where I could actually help people as well as build relationships over a long period of time. And that's why dentistry seemed to be an amazing fit for me. Now, when you go through dental school, after you graduate, most dentists will go and work with an older dentist or a senior dentist. That's where they pick up kind of the tools of the trade, and they figure out how to, run their practice and how things work. I did things a bit differently. I went off on my own. And when somebody goes off on their own, I only did what made sense to me. And that was, I saw one person at a time. If they needed dental work, I'd give a really good needle. I'd go, very slowly, do the best dentistry I could do. If they had a problem, I'd get them to lift their hand, I'd stop right away. And even before I did any dental procedures, on the first day they would come, we would chat, just like I did when I was working with my dad. I'd find out about them, I'd tell them about myself, and develop a bit of a relationship before I started doing any dentistry. And that style seemed to make sense to me. However, it also attracted people who didn't like going to the dentist. In the beginning, just a few, and year after year, I started to attract more and more people who didn't like going to the dentist, and I didn't really understand why. Then after a few years, there were so many people coming to see me, I decided to reach out to some of my colleagues and other people I went to dental school with. When we chatted about what they did and what I did, it turns out most general dentists will see sometimes 1 to 2 to 3 people at one time and go room to room to room, doing a little bit in each room, giving a needle and doing procedures. And they do this thing called block scheduling, where they actually allocate a certain amount of time to have a procedure completed in. However, sometimes some people have unique needs. They don't freeze well, they have a bit of a gag reflex, they're a bit anxious, they need a break. This type of scheduling, this block scheduling, was only a certain amount of time allocated to do a procedure, doesn't really allow for that and can make them uncomfortable where they come in to have, let's just say, a filling done and they've got 25 minutes to do a filling. However, the client needs a little bit of extra time for one of the reasons I talked about, but there's no time there. It ends up being rushed and gets done anyways at the discomfort or creating an uncomfortable appointment for the client. At our practice, what we've realized is after 15 years of doing this, that doesn't work for everybody. So what we've done is allowed a different system for people to become more comfortable. Let me explain further. After 15 years of doing this, I've realized that the people who are uncomfortable with dental appointments or have anxiety over dental appointments, that there's nothing wrong with them. Okay, they're not here to cure you because there's nothing wrong with those types of people. How they feel is normal for their history or for where they're at in life. If we use an analogy of someone being claustrophobic, if I was to take someone who's claustrophobic and lock them in a closet and take away the key, in about 30 seconds you'd see them kick the door down and the whole world will look at me and go, why would you lock someone who's claustrophobic in a closet? Evidently that they're it doesn't work for them. They're claustrophobic, they can't be in a small space, it doesn't make sense. As well, if I were afraid of heights and somebody held me over, and I'm a little bit afraid of heights, I don't tell everybody that, and somebody held me over a tall building, well, I would be quite uncomfortable and I'd be pretty scared, and it wouldn't make sense, and I wouldn't want to be held over anything high or anything like that. But the way I would feel hung over a building, the way someone would feel locked in a closet is exactly the way someone who's anxious about a dental appointment feels sitting in a dental chair. The difference is the world understands claustrophobia, the world understands a fear of heights, but there's not a lot of empathy for people who are anxious about dental appointments. These people actually have people tell them, what's the big deal? Suck it up, it's in your head. Kids go to the dentist, and all these things that belittle them, and it actually makes it even worse. Psychologically, it's very damaging, and it's very hard for them to get in the habit of going, and a lot of people just give up and stop going. So when people come see us and they go, Daniel, what is it you do? How can we be more comfortable? We offer 3 different levels of sedation. Simply give us your name and email address, and I'm going to give you private access to 3 videos I've made on 3 different levels of sedation to help get you into the dental office comfortably and allow you to get the dentistry you want or your mouth needs very comfortably with very little anxiety. Thanks so much.